Youth pitchers feeling the pinch of Tommy John surgery epidemic. Kellen Salanpa remembers the big games. There was a no-hitter in the championship game of a travel tournament when he was 12, the 120-pitch epoch, where nobody came close to hitting it out of the infield, and the high school playoff game in which he struck out the side in relief as a freshman. Salanpa was competitive, talented and threw hard. College recruiters were watching. But there was a problem. Salanpa kept throwing through elbow pain and eventually needed Tommy John elbow surgery, from which he would never fully recover. The procedure, in which a pitcher's ulnar collateral ligament in his throwing elbow is reconstructed, has become a topic of national conversation, with 28 major leaguers having the surgery or expecting to have it this year. But the injury is also shutting down players years before they even reach the big leagues, with the number of procedures at the youth level rising at an alarming rate. James Andrews, the famed orthopedic surgeon, has called it an epidemic. In 2000, Andrews and his colleague, Glenn Fleesig, reported performing Tommy John surgery on 17 youth and high school players, making up 18% of all elbow reconstructions they did that year. In 2010, the last time Andrews and Fleesig collected the data in a similar fashion, there were 41 surgeries on kids, making up 31% of the procedures. And Andrews says the stats have gotten worse. The largest number of all those different groups, believe it or not, is high school kids, Andrews told USA Today Sports. They outnumber the professionals. There was a tenfold increase in Tommy John at the high school, youth level in my practice since 2000. I'm doing way more of these procedures than I want to,